have been following it, has now come in double what was the budget expectations of it. We see that in every government program. That's what's going to happen here. But guess what? That is just more and more debt piled onto your children and piled onto your grandchildren. That's a concern. This cuts, 4 million seniors from Medicare Advantage, and it adds 15 million people to the rolls of Medicaid. Now, those of you that have been following Illinois' budget crunch, budget situation, a third of Illinois' budget is due to Medicaid. The government, the federal government now, to make it look nice on paper so they can say this is a budget neutral bill, they have dumped more people onto the state's Medicaid and in fact given an unfunded mandate to the states. So you are going to have to pay higher taxes to the state because they're going to have to raise taxes to pay for these unfunded mandates. This is a tough situation. And at the end of the day, when the bill is still fully implemented, there will still be 23 million people that are uninsured. That's still a lot. The process that happened, the bill that passed was the Senate bill. That Senate bill included what you've heard called the Cornhusker kickback. How many of you are Nebraska residents? If you are, you're lucky, because guess what? Under the Cornhusker kickback, you don't have to pay anything to Medicaid. The federal government's going to take care of that for you. Why? Because they needed your senator's vote to get this out of the Senate.
That's right.
If you're in Louisiana, they needed your senator's vote, so they did what's called the Louisiana Purchase. $300 million of your taxpayer money to purchase this vote, which basically subsidized their Medicaid requirements. And in Florida, they did something called Gatorade, which basically exempted 800,000 seniors that are on Medicare Advantage down there from being taken off Medicare Advantage, because they needed some Florida votes too. This is bought and paid for in taxpayer money, and it's not benefiting you. Now, they passed a reconciliation bill. The Senate is debating the reconciliation bill. Whether that passes or doesn't pass, I don't know. That reconciliation bill, when it passes the Senate, will be signed by the President and can amend this bill. But as of now, the bill that Debbie Halverson voted for, the bill that is implemented, is the Senate bill, which includes buyouts to purchase that, it passing the Senate. And I also want to talk just real quickly, because people are going to ask me, what is your view of reform? Let me say, I believe the Republican Party in the past has done a very bad job of recognizing and accepting the fact that medical costs have gotten out of control. And I believe they have. I believe we absolutely have to have medical cost reform. But now here's the fundamental difference. What we're talking about, what my party, what I'm talking about, is bringing the cost of health care down before we talk about where the government can step in and help people to afford it. Let's bring the cost down and then figure out what we can do to help folks that can't afford it. The Democrat plan that just passed, and let me stress, the only thing bipartisan about this plan was the opposition to it. That's it. This was a partisan bill that passed, but there was bipartisan opposition. 35 Democrats in the House voted against this. The Democrat plan says health care costs way too much money. So let's just write a big fat check to cover it. That's what that plan is. It does not address the costs. So what can we do? We absolutely, utterly have to have tort reform. Now, tort reform isn't the magic bullet. Tort reform won't be the magic bullet, but it will begin to significantly erode the cost of health care, and it will allow doctors the freedom to practice medicine between them and their patient as they see best fit, which is just very important. No more 7 MRIs, to cover the fact that they may get in trouble or whatever. Now it's just, hey, if you need this x-ray or you need this scan, we're going to give it to you. Otherwise, I don't want to put your body through that, and I don't want to put your wallet through that. We have to allow businesses and small groups and individuals to band together as very large groups to have the buying power that big companies have and to shop for insurance that way. And also, they need to be able to do it across state lines. We have got to lower the state line. Expansion of health savings accounts, allowing deductibility for qualified medical expenses when you file your taxes at the end of the year. Federally qualified health care clinics. These are clinics that can be located in areas where there's a lot of under and uninsured folks, and if they have a cough or they have some kind of a problem, they can go to these clinics and be treated instead of clogging up the emergency room.